You know that women can have an hour-long orgasm?
Look at his face! Oh my god, I can't. That was the best 2 seconds of the series so far. Still longer than Chase is gonna last though. House Season 1, Episode 3, Occam. I'm gonna be adding my insights as a doctor working in London. Let's see if I can get the diagnosis before House does. Let's go.
I really do. Hey, I really do have a cough.
Very interesting that he would suddenly become unresponsive like that. His eyes were open, there was no pre-warning, he looked vacant and flaccid as she was pushing him, all pointing towards an absent seizure, but it could be what we call syncope as well. Didn't seem to have any focal arm or leg weakness that would point to a stroke or any asymmetry of the face or pupils or facial droop. This case does remind me of one I saw in the hospital. 32-year-old female had come in having become totally unresponsive after orgasming during sex. We did a CT head immediately and we found a subarachnoid hemorrhage that was due to a berry aneurysm defect bursting, which is a defect in one of the large arteries inside the brain. It was like a ticking time bomb that went off during orgasm. I guess at least it went off while she was enjoying herself. What a way to go. This patient does also need an urgent CT, and I will be keen to see if he wakes up, how long that takes, whether he's exhausted, whether he's bitten his tongue or wet his pants afterwards, which can happen if this is more of a seizure. Let's find out.
Unless we control the blood pressure, he's going to start circling the drain before we can figure out what's wrong with him. Treating for sepsis, broad-spectrum antibiotics, and I want a cord stim test and an echocardiogram.
Okay, so symptoms that we just saw on that board were fever, cough, rash, low blood pressure that we know is not responding to fluids, nausea, and abdominal pain. The episode title is called Occam, which relates to Occam's razor, which is a principle of logic that says entities must not be multiplied beyond necessity. What does that mean? It means that if you've got two competing hypotheses on the same prediction, you should favor the one that has the fewest assumptions. It's attributed to William of Occam, which is a 14th century philosopher and theologian. Many people sometimes incorrectly simplify it to the simplest answer is usually the best, which isn't quite what William was trying to say, but we can understand why. How does that relate to our case? Well, we can focus on what we know and make the fewest assumptions possible. He's a young college child. He has a partner. He's sexually active. We know his blood count and his abdominal scan were normal. That likely rules out usual suspects like meningitis or appendicitis. Sexually transmitted infections like HIV or syphilis would be a simple explanation, but probably too simple for House. Rarer, more spicy, House-esque conditions could be things like hypertrophic cardiomyopathy, exacerbated by acute infection, von Hippel-Lindau, tuberous sclerosis, gastrointestinal stromal tumor, vasculitis, malaria, autonomic dysfunction, postural orthostatic tachycardia syndrome, TB, or contamination from his halls of residence by asbestos or another toxin. I'm curious to know more.
For most of you, this job could be done by a monkey with a bottle of Motrin. This is Vicodin. It's mine. You can't have any. And who would rather wait for one of the other two guys?
Well, that's one way to empty out your afternoon clinic. This seems totally bizarre, but seems not too dissimilar happen in some A&E departments in the UK. I had a patient recently, 29-year-old female who had symptoms of appendicitis but wasn't feeling too unwell. I sent her in to the emergency department to see the general surgeons, but when she was there, after 5 hours in A&E, the registrar, who's the equivalent of a resident in the US, came in and said, "We're extremely busy at the moment and wait times are up to 10 hours. Anyone who feels they don't have a life-threatening condition, please leave now." And that's without seeing any of the patients. She told me at that point she was going to leave, but because I had mentioned to her the importance of appendicitis, she decided to stay. She was seen by the surgeons shortly after. They had an ultrasound which showed a perforated appendix, which is an acute life-threatening condition, had an emergency appendicectomy and left hospital about 2 days later. Imagine if she had left before the operation, or some of the others who had left. I don't even want to think about it. It's crazy.
His BP's falling fast. There's fluid filling his lungs. His creatinine is rising. His kidneys are shutting down.
Interesting. So it seems like broad spectrum antibiotics House has started him on are leading to some kind of heart failure, reduced output on the kidneys, causing them to shut down too. In Porphyria cutanea tarda, the body has excess drug sensitivity, and it could be that he was fine until university or college. Now he started experimenting with alcohol or recreational drugs, and his body is reacting. That could also explain the sensitivity to antibiotics and his current failures. You could test this by measuring levels of perfluorobilinogen in the urine, as well as doing a drug screen. Treatment would include giving the patient something called hemin, which is a type of heme that limits the body's production of toxic perforins. Another treatment is to stop the offending drugs. Now, please tell me I've got it right. Now, if you're finding this reaction interesting and you want me to react to a medical drama of your choice, check out the channel membership by clicking the join button below. For a limited time, our Hall of Fame is open for the first 10 members. The top spot is taken by Joseph Randomness and the second by Amara Bekic. So these 8 other spots are open. The faster you join, the faster I can make your reaction video as well. So check that out if you're interested. Now let's find out what happens to our man.
No condition explains all these symptoms. Orange and green covers everything.
Occam's razor. The simplest explanation is always the best.
Which makes my idea 10 times better than yours.
Wow, okay, so House is now saying that viral myocarditis that Chase is suggesting, which is a 10 million to 1, is less likely than House's coexistence of 2 relatively common conditions, hypothyroidism as well as sinusitis, both are 1,000 to 1, which makes odds of 1,000,000 to 1. The issue here is that none of those numbers are actually accurate. Neither hypothyroidism nor myocarditis would explain the resistant blood pressure or drug reactions. Previously, it showed the heart rate as 95 on the monitor, which wouldn't be the case in severe hypothyroidism, since it would reduce the cardiac output by causing bradycardia, which would be a low heart rate below 60. So that's clearly not the case here. Both Chase and House do seem wrong. What makes things worse is that we know that this kid just got worse with antibiotics, and now House wants to skip all the tests because they take too long and start him on another penicillin for a sinus infection because tests take time. House, do you know what takes longer than tests? Reviving your patient from the dead. You could look into the sinus with the camera very easily. To be fair, this is only season 1, episode 3 though, so he does need a bit more experience. I'll let him off. If he wants me to come, I'm more than happy to do the nasal scope. It's quite a fun procedure, to be fair. Well, for the person doing it, less for the patient. I've had it done, it's quite uncomfortable. Now, a question to you, my audience. What is the most common cause of hypothyroidism in the developing world? Drop your answer down below.
I ran a TSH, T3 and T4. The patient's negative for hypothyroidism. Can't be 2 illnesses.
I am so glad you work here.
Wow, this episode gives such a deep insight into House's personality. He comes across as condescending and difficult just for the sake of it, but there is a reason behind it. He wants to engage the passion of his team. He wants them to do their best and try to prove him wrong and stay there to do it. For House, it's a win-win because either he's right, the patient gets better, or he's wrong and his team are so dedicated to proving him wrong that they find the answer. And Foreman is really stepping up to do it here. It reminds me of a very cool book that I read by award-winning writer Stephen King called On Writing a Memoir of the Craft. In the book, he says, related to starting the craft of writing, come with excitement, come with anxiety, with fear, with apprehension, but never with indifference. I think that's so true. Someone who cares about what they do is such an engaging and uplifting person to be around, and working with them or being served by them is always a pleasure. This definitely holds true in medicine, maybe even more than most careers. I've worked in the past with doctors who are understandably upset and demoralized by tough working conditions in the NHS. I relate and empathize with that. However, there are actions that we can take to try and improve things locally, and sometimes looking at the problem in a different way can actually change a lot. They say a pessimist finds problems in every opportunity and an optimist finds opportunities in every problem. If you're interested in listening to the audiobook that Stephen King did, I would highly recommend it. You can get the link down below and even listen to it with a free trial of Audible.
Go check his white blood count.
Sex could kill you. Do you know what the human body goes through when you have sex? Pupils dilate, arteries constrict.
She's not wrong. A German study recently found that 1,000 people died a year while having sex, mainly from heart attacks, at the average age of 59 years old. That's the age where you have to choose your priorities, guys. Luckily, most of you watching this are 25 to 35, so by the time you reach that age, Elon Musk would have cured mortality. Anyways, I love this Cameron. She seems so innocent, but Chase is gonna implode with tension faster than you can say semen retention. I don't want to give too much away, but it's nice to see this early innocent part of their relationship. Read the white cell count House was talking about to test what's going on, because they already said his blood count was normal. You see, the blood count comes with hemoglobin, white cell count, red cell size, concentration as standard. It's like saying you subscribe to just one show on Netflix. It just doesn't happen.
You know that women can have an hour-long orgasm?
Look at his face! Oh my god, I can't. That is just too good. Oh my god, I'm creasing. That's the look of a man whose imagination is in another dimension, where he's playing smooth R&B, lighting candles. That was the best 2 seconds of the series so far. Still longer than Chase is gonna last though.
We were both wrong. White cell count is down, way down and dropping.
I'm gonna push the needle into your hip bone and take some of them out.
The pharmacist gave him gout medicine instead of cough medicine.
A lot to go through here. Looks like we have a new symptom, bone marrow suppression. We've done a biopsy to try and diagnose the cause. House now thinks all his problems are due to being given colchicine for a cough incorrectly by the pharmacist because of inappropriate prescribing. I would be very worried about a leukemia with immunosuppression with someone who's that young. I know this is a TV program, but it can be frustrating that they jump straight to bone marrow biopsy before checking his lymph nodes, doing a HIV test, and complement or immunoglobulin levels to check for inherited deficiencies, more common explanations for his immunosuppression, particularly as this episode is called Occam, so less assumptions. I had an interesting case recently of a 2-year-old boy. He started to cough and went to the urgent care center because his mom was very anxious. They prescribed him antibiotics at her insistence after doing a chest x-ray which was clear. What is less clear is why they agreed to the antibiotics, since usually you would only give it if there were a clear focus of the bacterial infection. Then the patient came to my clinic about 4 or 5 days later with diarrhea and vomiting after the antibiotics. These treatments are not without consequences, especially as the broad spectrum antibiotics wipe out the gut flora, which we are growingly realizing are very important to many different bodily functions. Moral of the story, make sure you definitely need the medications you're given before taking them. Sometimes it's easier for the doctor to just write a prescription and ask you to leave than talk through a more beneficial treatment. It's sad to say, but it does happen.
I'm just a pharmacist, but I know what cough medicine looks like, doctor. Do an exploratory laparotomy and find out what's in there.
He has no blood pressure, no immune system, and no kidneys.
Let's stick with the wrong pill theory.
What? Okay, so now they want to do an exploratory laparotomy, which is basically cutting open the patient's abdomen from top to bottom. Even though they've already done a CT scan which shows it's negative, what are they even looking for? They don't have a differential. There are only a few conditions that you can even diagnose like this, one of which is endometriosis, which produces chocolate-covered cysts. Less tasty than they sound. One problem though, he doesn't have a uterus. I don't think they'll go ahead with this op. I can't see how they're gonna find anything there. I think they're gonna notice something on the way to doing the op. Maybe they intubate and realize he's got a rare complication of syphilis and his pupils aren't reacting. Let's see. By the way, that small yellow cough pill was probably chlorphenamine, which is an antihistamine that causes drowsiness and suppresses cough. Not usually needed or recommended though, to be honest. House thinks the patient's OD'd on colchicine. So let's see.
Pressure's dropped.
Via. Charging. Clear. Sinus rhythm.
He's back! Guess he's not having surgery then. That cardiac arrest was probably less risky than the surgery, to be honest. There were a few things about that resurrection scene though that weren't quite right. First of all, the monitor at the back, if you notice, when she said the pressure was dropping, was still in sinus rhythm. Then they say he's in VF, which is a totally different rhythm. So if that was the cause of the pressure dropping, then the trace should have been different and it stayed the same pretty much through the whole scene, even though he was arrested. Second, they never do any chest compressions or even check the man's pulse until after they decided to give him a bit of a barbecue. Third, they left the oxygen on and the low flow through the nasal cannula, which is no good. You want 15 liters non-rebreathe mask through a handbag to ventilate someone who's been arrested. Keep the oxygen flowing. But why does any of that matter at all when all it takes is one little shock to pull you back down the escalator to heaven's gate?
Colchicine does its damage and it screws up your bone marrow, and then neuropathy happens after that. Hair loss. Your special boy is doing drugs.
Oh, spicy! Well done, House. The colchicine was in the drugs. I did mention at the start he could be doing drugs, but not quite there with the colchicine though. If it is colchicine poisoning, it is usually fatal, but there are experimental treatments that can help to clear it within 7 to 10 days after ingestion. Colchicine disrupts immunity by affecting a molecule called tubulin, which are key components of cell cytoskeletons involved in cell division. At low concentration, it simply stops the growth of microtubules, but in high concentration, it starts to break them down. Since this mechanism of colchicine could have been beneficial in stopping growth and division of cancer cells, it was investigated as an agent to try and treat cancer, but it was decided that it was too toxic in the doses needed to use. So that's how bad it could be. Let's see if he improves.
Ecstasy?
Twice with Dan and Mike.
You know what they cut that stuff with? Apparently colchicine.
The antibodies we're giving you should neutralize colchicine.
Oh, colchicine in ecstasy. Wow. I thought they usually cut drugs with things that help give you a little bit of an extra high. Can you imagine if you go to a party, you've got gout, you decide to take some ecstasy and you're like, wow, this ecstasy is just so good for my toe pain. I suppose that would enhance the high. To be fair though, he said he just did the ecstasy twice, which doesn't quite explain how he would get an overdose of colchicine, although there have been toxic reports with just 7 tablets, so it's plausible, even though unlikely. Either way, it's not a medication to play around with. Other ones that can be very dangerous in overdose are tricyclic antidepressants like amitriptyline, benzodiazepines like Valium or Xanax, which are the second most likely causes of fatality in overdose. And at the top of the list, can you guess what it is? It's opioids like oxycodone, morphine, fentanyl. They're the most common cause of fatal overdose, accidentally at least. I once had a patient in palliative care that came into the hospice. Everyone thought she was dying, she had cancer. I looked at her back and there was a fentanyl patch still on there. Checked her leg and she had a second one that hadn't been removed. The district nurses had missed that patch on the leg before applying the new one to the back. Took them both off, and after a few hours she actually woke up. The pinpoint pupils were a little bit of a giveaway, and we did help her along with some naloxone also. That worked a little bit faster.
When will you know?
We know now.
You should invite Dr. House.
Will he come?
No, but he'll send a gift.
You can imagine throwing a party and Dr. House turning up. That would literally make my day. It looks like the patient's better though. Seems like the antibody that they gave to neutralize the colchicine has worked, and his heart has gone back to doing a normal output. Interestingly, House does act a little bit antisocial, a little bit like a hater, but I reckon if he turned up, he would be the life of the party with his dry wit and facts about chimpanzee testicles. Also, his pill theory about the cough medicine was right. The pharmacist did mess them up. What a genius. I can't keep up just yet. I better get back to the textbooks. But before I do, I need to diagnose you. It seems like you have a house reaction deficiency. Oh look, the cure's just popping up just there. Why don't you treat yourself? Stay curious. I'm Sarah Man.